Staphylococcus aureus, presented by Lauren McKenzie. The basics. Staphylococcus aureus is gram-positive bacteria. It is spherical, anywhere from pairs to grape-like clusters. It's non-spore-forming, non-motile. It's facultative anaerobe. It's small in size, salt-tolerant, coagulase positive, catalase positive, novobiocin sensitive, mannitol fermentation positive. And those are all ways how to distinguish S. aureus from other bacteria. And if looks could kill, its pathogenic properties. As you can see in the upper right-hand corner, the staphylococci do have a grape-like cluster, hence the name. The geographical occurrence, it is worldwide. The high-risk individuals are the very young children, elderly, and immunocompromised persons. Other individuals at high risk can include those who have exposed or draining wounds, sharing personal items such as razors or towels, recently staying in a healthcare facility, using injectable drugs, or exposure to patients with staph. Also, IV devices, dialysis devices, and nursing homes can transmit. Staphylococcus aureus resides in the human nasal passages in the axillae, on the skin as normal flora, and it also may reside on some animals. Staphylococcus aureus can infect the body in several ways. Primary infections and complications can include, but are not limited to, if ingested, it can cause food poisoning from released enterotoxins. If on the skin, it can cause lesions, boils, styes, and or localized abscesses. If in the bloodstream, it can cause sepsis. It can also cause endocarditis, pneumonia, and osteomyelitis, and is a major cause of HAIs, or healthcare-acquired infections from surgical wounds. It can also cause toxic shock syndrome, TSS, mastitis, urinary tract infection, UTIs, or meningitis. Also, MRSA, methicillin-resistant Staphylococcus aureus, is one of the many strands of Staphylococcus aureus that is antibiotic resistant. The incubation period varies based off of the infection type, about 1 to 10 days. S. aureus food poisoning can last anywhere from 30 minutes to 8 hours, and the period of illness varies depending on the infection and how quickly treatment is received. It could be anywhere from a day to several weeks, and the contagious period also varies. The average is about 4 to 10 days. All of these are based on of how Staphylococcus aureus is affecting your body. In the limelight, signs and symptoms, as you can see on the left-hand side, we have abscesses, boils, cellulitis, folliculitis, and impetigo. It is included but not limited to in foodborne illness, nausea, vomiting, stomach cramps, diarrhea, dehydration, low blood pressure. On the skin, we have boils, impetigo, folliculitis, cellulitis, abscesses, blisters, staphylococcal scalded skin syndrome, mostly in babies and children, fever, rash, and occasionally blisters, fever, rash, muscle aches, pains, confusion, joint swelling, irritated skin, complications due to the spread of S. aureus can have their own specific symptoms. And I would like to highlight sepsis. According to the CDC, 1 in 3 patients who dies in the hospital has sepsis. Almost any infection can lead to sepsis. Act fast. Sepsis is a medical emergency. And when in doubt, seek it out. Go be seen by healthcare professionals. It could save your life and your loved ones too. And as you see on the right-hand side, here is a picture of the symptoms of sepsis. Now what? Diagnosing. S. aureus infections can be diagnosed by your primary health physician via the following: physical exam, sample collection, and other tests for the suspected infection site or source, such as an echocardiogram. Sample collection, a physical exam, a doctor will look at your skin and into any symptoms you may have. Then the doctor will order samples to be collected, and those can include, but are not limited to, blood, urine, skin, nasal secretions, and infected materials, such as a catheter. And wash your hands often, at least 20 seconds with soap and warm water. Clean your body regularly, especially after sweaty activities such as working out. Clean all wounds, cuts, scrapes until they're healed. Don't share personal items like bed sheets, razors, towels, and clothing. And don't use a tampon for more than 8 hours, and try to alternate between pads and tampons for even better protection. And treatment can include strains like antibiotics, but it is very adaptable. So there are some antibiotics that really don't work anymore. Drain the skin, the wound, and clean it. remove the device that's causing the infection, such as catheter, IV pacemaker, and other medicine can help, such as if you're dealing with dehydration, you're going to get those antibiotics for that, or the electrolytes for that. Also, according to the National Institute of Health in April of 2021, a new antibiotic is going to be tested. It's called dalbavancin, and you can read it at the last bullet point right there. Here are my sources, and thank you so much.